What is pneumonia? It's a deceptively easy question for nursing students because unless you're already using the silver bullet study system to study, I would almost guarantee that you are overcomplicating and overstudying something like pneumonia. So take a second, use this active learning strategy, and pause this video and just say out loud, even if you just whispered under your breath, what would you define pneumonia as? Because then I'm going to tell you. Now, did your mind automatically go to some of the symptoms like pain upon breathing, maybe some of the different types of breath sounds you would hear, maybe some coughing, fever, things like that? Because that's not what pneumonia is. And if that's how you've been studying things in nursing school, then it's no wonder that you're continuing to have problems. To feel like you're never studying the right things that are on the exams, to feel like you're having trouble connecting the dots, you're having difficulty retaining the information long term, and that in the end, you just don't quite understand what the test questions are really asking you. Now, I'm going to tell you what pneumonia is in one sentence. Pneumonia is inflammation of the lungs. That's it. In fact, it's step 2 of the silver bullet study system. Now, there's a step 2B where we kind of dig in a little deeper to say what causes that inflammation, because there's 4 different causes of pneumonia. If you know what they are, drop them in the comments. But in order to understand what pneumonia is, the inflammation of the lungs, you have to understand what is normal in the lungs. Basically no inflammation. That's pretty easy, right? And what the normal anatomy and physiology of the lungs is and what the job of the lungs usually is. You might need to know this in more detail than you already do. But if you know what's normal, that's step 1 of the silver bullet study system. If you know what's broken or what's changed, that would be inflammation of the lungs in this case. Now you can switch the way you're studying for steps 3 and 4 so that you can start practicing how to think about the information. This is the key to learning how to think like a nurse and doing better on your exam so you actually know what the questions are asking you. It's also the key to retaining this information long-term so you never forget it. And it's also going to prevent you from overstudying and get rid of that constant feeling like you've never studied enough. Because now that you're on step 3, we're going to predict what symptoms you're going to see. And instead of memorizing this random list of symptoms that you could see in lots of other diseases too, now you're going to be able to predict the symptoms based on what you already know about steps 1 and 2. What do the lungs normally do and what can't they do anymore because of the inflammation? And I bet your mind can already come up with a few things, although it might seem too easy. You're going to have difficulty breathing. You're going to have those breath sounds because of the inflammation and the mucus and the inflammatory process that's blocking the airways. And then when you get to step 4, we're predicting, what are we going to do about it? We're going to address those symptoms. We're going to address the root cause of the inflammation and try to correct it. The rest of it's just filling in the blanks by pulling things out from your textbook, not reading your textbook like a novel. And yes, the silver bullet study system can be applied to other classes in med-surg, like fundamentals and health assessment too. Even your prereqs. Learn it for free. Link in